Good afternoon, ladies and gentlemen. That was quite exciting theme tune for me. I didn't know I had a theme tune. I'd very much like to welcome you to the Excellence Network 2009. I'm Brona Miskelly. I'm the editor of Community Care. But this time last year, I wasn't. I was yet to take over the job, but I was very lucky I had the opportunity to come to last year's Excellence Network ceremony and sit down and watch and find out about the great teams we honoured. And as I sat there, I was increasingly impressed about the work being done. And to be honest, I realised I'd made the right choice in changing jobs because I was going to get the opportunity to work with people like you who are incredibly inspiring. So for me, it's particularly exciting to be introducing this year's event, which of course features another set of great projects. The Excellence Network seeks to identify and share leading edge practice. Most teams out there are striving to improve outcomes for service users, and to give them more control, more choice, and dignity. But the transforming the way we deliver social care isn't easy. Teams are having to embrace an astonishing number of new policy initiatives. David Behan earlier in his keynote was asking you people how many they'd read, and there's a lot to read out there. And at the same time, there's greater demand and tightening resources. Some have worked through the problems carefully. They've involved both service users and frontline staff and are offering more preventative, personalised and multidisciplinary services. 25 of those teams are in the room today. These are 25 that our judges felt could teach others something. 25 inspirational teams. Now, through the magazine, through the website, and through events like Live out there, we'll be communicating those practical messages and sharing the inspiration and the ideas you are offering to other teams. Plus, we'll be finding other ways for the honoured teams to share ideas among each other. Now, as well as recognising those 25 teams, we'll also be introducing you to 10 outstanding individuals, our champions, our community care champions. These are people who exemplify social care's values and are dedicated to their cause, the people who go the extra mile. They'll provide role models at a time when social care workforce is being challenged. To be honest, it's a shame we can only pick 10, but 10 it is. So many of you go the extra mile every day, and not just when it comes to transforming services. And that's why at Community Care, we also have the Stand Up Now for Social Work campaign, which is about greater respect and understanding of social care in the media, in the greater public. One of our aims is to share stories of good outcomes and the fantastic work being done across the country. And the Excellence Network gives us another opportunity to do that, because again, in the room, we have some of the best examples of that. So today is a celebration of your important role, and to be honest, we wouldn't be here without the kind support of our sponsors, Hillcrest, Northern Care, Key Childcare, For Social Work, and the Department of Health. Thanks go to them for supporting this groundbreaking initiative. And so, here in a few words, they're going to explain why they're involved. We're going to start with the Minister of State for Care Services, Phil Hope, who unfortunately hasn't been able to attend today after all.
Can I start by saying how disappointed I am that I can't be with you today, as so many of you celebrate becoming members of the Community Care Excellence Network. I was very much looking forward to meeting the teams and the champions in person and to hear some of your stories. I'm delighted and proud that the Department of Health is one of the sponsors of the Community Care Excellence Network. Good practice should be shared and spread so that as many people as possible benefit from it. And the network is a great way of making sure that the great work you're all doing is used to its best effect. You can't put a price on the value of your contribution. You make the difference to so many people whose lives would be a great deal poorer without your skills, your talent, your dedication and your commitment. The range of people who benefit from your hard work and creativity spans generational and societal divides. Children and families, older people, those with mental health problems, others with physical and learning disabilities, all kinds of people with one thing in common. They depend on people like you to make a real difference to their lives. One of the most exciting things about the work, which is being recognised today, is that it is responsive to the needs, the wishes and desires of the people you provide care for. You're all making a massive contribution to communities up and down the country. Thanks to you, our communities are getting better, and particularly They're becoming better for all those people who rely on social care, who are feeling a genuinely transformative effect on their daily lives. The whole of the social care community can learn from the trailblazers, and there are many of those who are at this event today. I hope that as others hear about the work you're doing and the innovation, the excellence which you're championing, that they will feel as inspired as I am by your example. We need to make the exceptional level of care that you deliver the standard, so that every single person who receives social care gets the best care possible. And excellent care requires excellent people, as every one of you here today proves. But we shouldn't sit back and rely on people like you to deliver without any support or direction. If we want the best for everyone out there, we must take steps to make sure they get it. And that's what we're doing with our new adult social care workforce strategy, which was launched at the end of last month. We need the best leaders, the best managers, the best frontline staff, all working together towards shared goals. We want a 21st century care system with a 21st century workforce to deliver it. We want the whole social care system to be as good as those honoured here today. All of you who are collecting awards today have been chosen in the face of hot competition by an expert panel of judges who I know had a very difficult task. I'm sure you'd like to join me in thanking them for their time and skill in making some very difficult decisions. I hope all of you will have a wonderful time today, and please be assured that although I'm unable to join you as I'd hoped, I am most definitely with you in spirit as you celebrate some great achievements.